all your pastry, bakery, and quality food, CK Restaurant is the only place to be. We do catering for birthdays, weddings, and all related services. We have all kinds of local foods, American, European, and even beyond. Come and have a taste of our local juice, ebe, and other services. At CK Restaurant, customer satisfaction is our priority.
Are you thinking of owning your dream homes? EJ Investment is here for you. Secure our quality bungalows with 2, 3, or 4 bedrooms, or our story buildings, 3 or 4 to 5 bedrooms at very affordable prices with flexible payment plans at our Sanyang Seaview Estate, where you can enjoy the cool breeze with modern infrastructure such as tar roads, covered drainage system, modern electrification with street lights, gated entrance with security posts, and social amenities such as gas station, shopping mall, medical clinic, park, schools, children daycare, and a lot more. Our dedicated team of professionals will keep the estate clean at all times, provide security and patrol team within the estate premises, install latest technologies such as CCTV, Wi-Fi, home network installation, solar panel, and power backup system. Also, check out for our additional home facilities and interior design service such as premium tiling, wall plaster, home landscape, fingerprint home lock, and a lot more. Visit our office at Senegambia Kololi Highway and get a free site visit tour, or contact us on 4464-838. WhatsApp us on 3259220. Or you can visit our Facebook page or Instagram on EJ Investments. EJ Investments, we are first in properties.
Islamic microfinance is becoming an increasingly popular mechanism for poverty alleviation, especially for developing countries around the world. This microfinance service adheres to the principles of Islam as a form of social responsibility. Yona Islamic Microfinance is the Islamic microfinance of choice in the Gambia, trustworthy and reliable. At Yona Islamic Microfinance, we provide savings products, current accounts, financing products in conformity with Islam. In addition, Yona Islamic Microfinance also offers local and international remittances, takaful fund, management of zakat, management of awqaf, trading and investment, and building of strategic partnerships to bring financial services to the doorstep of the poor with donor projects, madrasas, youth organizations, women groups, and farmer organizations. Make a choice with Yona Islamic Microfinance today. For more information on Yona Islamic Microfinance, call 377-2151 or 9832-151, or visit Yona head office at Tipa Garage, Bakote, or visit any Yona branch located countrywide near you.
Good morning to all of you and welcome, and we'll start the program now. Before we start the program, I want us to pray in our own ways. This will take 1 to 2 minutes, so can we pray silently in our own ways? Amen. May Allah accept our prayers, and may we have a fruitful deliberation on this important document. Today we are gathered here to witness the validation of the National Health Sector Strategy Policy, Health Sector Policy 2021-2030 with the theme, Building Partnership for Quality Healthcare for All. Very important theme, very ambitious team, and a team that when we, through partnership, collaboration, and networking, we should be able to achieve the objectives. On the agenda we have registration, which I'm sure have been completed before. As you come in, you get registered. And in case you are not registered, kindly check with the organizers for you to be registered to this important meeting. And we will have welcome remarks by the Permanent Secretary, and we also have the overview of the policy development process by the Director of Planning. We also have a presentation on the objectives and expected outcomes of the workshop, which is going to be delivered by the consultant, Dr. George. And we're going to have remarks by the World Bank Tax Team Leader, the TTL, Dr. Sam Mills, who will also give a statement via video link. And some of you are also connected online, and some are also here. We have both face-to-face and also online meeting. So Dr. Sam Mills will do his presentation online. We also have a presentation or remarks by the WHO country representative, Dr. Desta, who is ably represented here. And we also finally have the opening remarks by the Honorable Minister of Health, Honorable Ahmed Lamin Samate. And then we have photo session, and that's we're going to have coffee break. And that will mark the end of my moderation for this particular first part of the meeting. The National Health Policy, or National Health Sector Policy 2021-2030, very important document for the health sector. When validated and being implemented, it is going to be a document that's going to guide our process of implementation, and it's going to help us to be able to achieve what we set for ourselves as a ministry. On that note, I now invite the Permanent Secretary, Mohamed Lamin Jaite, to give us the welcome remarks.
The Honorable Minister of Health, Dr. Ahmadou Lamin Samate, the Deputy Permanent Secretary, Mrs. Fanta Baiseka, our able consultant, Dr. Melvin George, here present, the representative of the WHO, Dr. Makawa, on behalf of the representative of WHO, Dr. Desta, who is not here with us. The Director of Planning, Mr. Jibril Jayu, distinguished members of the audience, the members, representative from the partner circles, senior members from the ministry, directors, the CEOs from the hospitals, the representative of the Director of Health Service, regional representatives, the members of the media, distinguished ladies and gentlemen, and all other protocols respectfully observed. I am delighted to be here this morning and to welcome you on behalf of the Honorable Minister of Health, the entire senior management and members of the Ministry of Health, and indeed on my own humble behalf, welcome you to this very, very important two-day validation workshop with the theme Building Partnership for Quality Healthcare for All. This workshop is the validation of the Ministry of Health's National Health Policy 2021-2030. The policy
Recording in progress.
is the successor to the previous health sector policy for the period 2012-2020. Today's event is the climax and culmination of a series of diligent engagements towards development of a national instrument that sets our national vision and agenda as far as health is concerned. Prior to this day, many workshops were held, as well as a series of review sessions conducted to capture the vision, the aspiration, and the input of all and sundry so as to concretize this very important national health agenda. We are grateful as a ministry to all of you, our dear partners and friends, for your continuous collaborative support and commitment to this day. On behalf of the Ministry of Health, we are most grateful to all our technical directors, our partners, and the entire members of the communities who have participated in one way or the other in contributing towards the development of this policy that we are about to validate today. In this policy, we have attempted to carve out and capture to the best of our ability the national vision as set in the National Development Plan and in line with the global health vision. And to this day,
Recording
we are
stopped.
happy
Recording
to say
in
that
progress.
the document so far presented has featured a lot of reorientations, policy reorientations, and innovative strategies that can lead us into the aspirations of the government of the day. On behalf of the Honorable Minister, on my own humble behalf, I want to once again thank all of you for coming in response to our invitation. And we hope and pray that your contributions, and at the end of the day, the ultimate objective set for this workshop will be achieved. I cannot close without recognizing the diligent efforts of our technical team at the Department Directorate of Planning and Information for spearheading the overall coordination of this policy development process from inception to date. We want to also thank in absentia my colleague Permanent Secretary, Mr. Lamin Damfa, the Director of Health Service, Dr. Mustafa Bitey, and our Deputy Director, Deputy Permanent Secretary Planning, Technical, Mr. Karamba Keta, as well as all of you, the directors, for your input into this process and for your continuous commitment and cooperation that led us to the development of this draft policy. On that note, I want to thank all of you for your kind attention.
Thank you very much, P.S. Jete. Now we are all welcome to this hall. He has also extended gratitude to the people behind, or the brain behind, the development of this important document, highlighting the role of the Directorate of Planning and Information for spearheading and coordinating this important development process. He has also acknowledged the efforts of each and every one of you, all the directors, program managers, CEOs, heads of NGOs, also representatives of the civil society. It was done in a multi-sectoral way, in a participatory way, and everybody really participated from the beginning to now. And we will have the details of that process to be presented by the Director of Planning and Information, Mr. Jibril Jaju. Jibril, kindly come forward to do your presentation on the overview of the policy development process.
Good morning to you all. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuhu. Distinguished ladies and gentlemen, I will first and foremost begin by showing our special appreciation to the entire Ministry of Health senior management team, headed by the Honorable Minister, with the 2 permanent secretaries, 2 deputy permanent secretaries, and all the 9 directors, and all the 7 regional directors for the trust they have on the Directorate of Planning and Information to be able to deliver, a new health policy. On that note, I want to start by recognizing he has been a director of health services, and currently he is the chairman of the Medical and Dental Council. So this is the individual that will facilitate the validation process, and you can see he's a well-experienced locally, internationally, and we are proud to have him in our midst. And during our interaction with him for the past 1-2 months, we have learned a lot from him, and his input is definitely well appreciated. That is Mr. George, who will follow suit after my presentation. Thank you very much, Mr. Chair. I bet you.
Thank you very much, Jibril. That was okay to give, to provide more information about Dr. Melvin George, so that those who don't know him will know him more, and those who have never interacted or met with him, they will know what he has done for the health sector in the Gambia, and also when he also served as WR in Uganda and as well as in Ghana. But also want to tell you that he still remembered in Uganda, and then also remembered in Ghana. Every day people are talking about the work he has done in Ghana and also Uganda. You go to some of the areas, they will tell you, oh, we had a Gambian who was here as WR. He was able to help us to do A, B, and C. So the name is still lingering in the minds of the people in Uganda and also in the minds of the people in Ghana. So thank you very much, Dr. George, for those selfless work we have done in those countries to provide them with appropriate healthcare service in terms of health system strengthening. We are happy to have you, to have our own individual, our own brain, our own expert to lead us into this process. So we are happy that you are here with us. Mr. Jibril also mentioned about the consultative process. We started with the consultation with the grassroots from lower level to the upper level. And then that's where they met again to look at what's to be done, the next steps. And there was a roadmap developed, and also capacities of people who are supposed to facilitate or coordinate this important development process were also built. That means we have built capacities at the level of the DPI, and that has really helped us. With the guidance of the consultant, at least we're able to come up with such a fantastic document. I think the Director of Planning, they deserve a round of applause for this wonderful initiative. We also mentioned the participation and inclusiveness of the entire development process, and has also highlighted the role of the Honorable Minister because of the interest he has in improving the healthcare service delivery in this country. He was able to call up the senior management meeting where he proposed some new vision, new ideas, new technologies, new strategies for the health sector for it to be included in the policy. So we also have to thank the Honorable Minister and the Permanent Secretary for creating the enabling environment for this particular process to start, up to finish, and now we have also received the draft document. The Honorable Minister also deserves a round of applause. Followed by the Permanent Secretary, because everything started with him, and he also got and briefed the Minister to get his blessing and endorsement. So the peers also deserve a round of applause. Thank you very much. Now invite our humble boss, Dr. Melvin George, who is a consultant, to do a presentation on the objectives and expected outcomes of this 2 days workshop. That's today and tomorrow. Dr. George, you're most welcome.
Honorable Minister of Health, members of the High Table, Permanent Secretary, DPS, Director of Planning, Permanent Secretary, Office of the President, colleagues, first of all, let me thank the Minister of Health and WHO for granting me the singular privilege and honor to undertake this work. For me, it is an honor, a privilege, because this is a sector I think I know best, as I've worked most of my life with it. And the good thing is that I have worked with most of you during this process, during these past years. All of us did good work, and I'm happy to see that you also continue this good work. At the end of the day, it's our people that we want to serve and to give them the best of what we can do for them, because we are in a more privileged position than most of them. So we should at all times remember that it's a service to the community, service for the people who are less fortunate than us. So thank you very much, and I look forward to a successful workshop, which we all can work together to bring a lot of satisfaction, not only to the ministry, but also the whole people of the Gambia. So the workshop is the National Health Sector Policy 2021 Validation Workshop, and the theme, as you've heard, is building partnerships for quality health care for all. When I looked at the definition of validation, I think sometimes we just use the word validation, but it's important. And one of the definitions is that the act of process of making something officially or legally acceptable or approved. So this is a very serious meeting, very serious workshop, because we're all trying to get somebody that is officially, legally accepted and approved. And of course, I know that the Honorable Minister, once the process is completed, will take it to Cabinet, I assume, I guess, and Cabinet then put its seal on it, and this will become a binding document. So this is an important process, and I'm sure we're all going to take it very seriously. Next slide, please. Like any workshop, I think sometimes it's important for us to remind ourselves, why are we here? What are the objectives of the workshop? I think it's important. We've had from the DPI, Director of Planning and Information, he has told you that the objectives is a continuation. First of all, to have a common understanding of the consultative process in developing the policy. He told you he started within the ministry itself. We moved on to the community. We talked to chiefs, alcalis, governors. Then we went to the MDAs, the other ministries, departments, and other agencies. And then we went to the UN body, to our partners, UN, etc., and other development partners. And so, really, the first one is that we want now to validate that process, to say, yes, we did have this common understanding. Because if we do, then we do not say we are not involved. So this is to say we are involved with the policy. So just it's a confirmation. Then the other objective is to build consensus and agreement on the policy. This consensus and agreement is important because once we all agree here that this is what the policy is about, then we will all put our heads together to make sure that this policy is implemented to the letter. And then there will be nobody else coming in to, to ambush the policy, bring in something else, to deviate our minds. And sometimes these things can even lead to wastage and duplication of efforts. So it's important that if we all agree to say, yes, this is the policy, then let's put our minds to it. And then, of course, to commit and support the implementation of the policy. Again, it is follow-up that we must be committed. Once we agree on all of these things, to say that, yes, we were involved in part of it, yes, we agree with what is in it, now let's put our minds towards implementing the policy. Next slide, please. So obviously, the expected outcomes, sometimes I say to people, is when we go to a workshop, we should always be asking ourselves, have we achieved what we started upon to achieve? So I can go home and I can say, yes, we really achieved the issue of a common understanding. Yes, we were able to achieve that part of the workshop. We confirmed and we agreed that yes, this was done. Then we also, as an outcome, to say yes, we now can say we all agree. Of course, that is why the workshop is here, because there will be discussions, not so. There will be inputs, okay? It's not cast in concrete yet. So your consensus, your comments now will bring us together to say, yes, we agreed this is a document that is fit for function and fit for purpose. That is why, in fact, you see, we have a theme. The theme of the policy is is building partnerships for quality healthcare. It's very important aspect. Then, of course, the third expected outcome is to say, now that we have agreed on all of these things, we are now to commit ourselves, our ministries, the Ministry of Environment, Ministry of Finance, all the other ministries, the departments, and everybody, the community, the chiefs, to say, yes, we're now going to implement this policy. Next slide. Just the next one is just the housekeeping. Again, please, I know that these days technology can sometimes disrupt our lives. And I remember somebody saying to me, you know, what would have happened if there was no mobile phone? Our work will continue, but mobile phones make our lives so difficult. So please, crave your indulgence if you can have all our phones on silence. And if you have to speak, somebody will tell you it's an urgent call, you know, somebody is dying, you know, so you have to go. So even if you have to speak, kindly leave the room, because if you don't, you'll be distracting your colleagues. And the other one is, please try to respect the program guide and keep to time. Time for lunch, when I think going to have a bell to say end of lunch, let us all come together. For break, let us, end of prayer time, let us keep to the time. And then, the most important, it would be very nice to listen to each other when each one is speaking. I think it's just, you know, let's listen to each other, and then so you don't interrupt people, and then you can have a wonderful workshop. I think that's the last slide, I think. Okay, I think that's all. That's the last slide. Thank you. Thank you very much.
Thank you very much, Dr. George, and thank you also for those reminders. I think we've been advised what to do and what is expected of us. I also want to recognize the presence of the Permanent Secretary, Office of the Vice President, Mr. Dauda Sise, who has also joined us. Dauda, welcome. I now move on to the next item on the agenda. That's the remarks by Dr. Sam Mills, World Bank TTL. Is Sam connected? Can we check whether there is, Sam is online? Yeah.
Hello, good morning.
Okay, thank you. Morning, Sam. I'm sorry it may be too early over there, but thank you for waking up this early morning to give us this statement. So you're most welcome, Sam. You can give your statement.
Distinguished ladies and gentlemen, it gives me great pleasure to join this important validation workshop early this morning from Washington. As we all know, both the National Health Policy 2012 to 2020 and the National Strategic Plan 2014 to 2020 expired last year. The World Bank approved 30 million for the Essential Health Services Strengthening Project, which was to support the implementation of the new policy and strategic plan. Again, in November this year, the World Bank approved an additional $50 million with the assurance that the new policy and strategy would be adopted this month. Since, as we all know, the policy was drafted several months ago. We all appreciate the elaborate consultative processes that Jibril explained earlier. I think this was worth the wait. I was pleased on Monday when Jibril sent me a message that the validation workshop will be held today and tomorrow. I want to take this opportunity to congratulate His Excellency Honorable Samate, the Ministry of Health Senior Management Team, the Directorate of Planning and Information, MOH personnel, development partners, consultants, and all of you who have contributed to the drafting of this policy. You all agree with me that the Ministry of Health has made impressive gains this year. The National Health Insurance Act was passed by the National Assembly last month, and preparations are already underway for the mass National Health Insurance membership registration linked to the electronic birth registration beginning January 31st. Additionally, the Ministry of Health has developed and costed the essential healthcare package for each level of the healthcare delivery system. For the village health services, community clinics, minor health centers, major health centers, the district hospitals, general hospitals, and the teaching hospital as well. Additionally, performance-based contracting of all health facilities has been expanded nationally. Last year, the performance-based contracting was limited to 5 regions, but it has now been expanded to include Western Regions 1 and 2 as well. There are several other activities that the ministry has initiated which will contribute to the smooth rollout of the new health policy. After this validation workshop, we hope the strategic plan would also be adopted shortly. We look forward to 2022 with hope and enthusiasm for universal health coverage, for quality health care for all in the Gambia. Thank you very much. I wish you the best in the deliberations today and tomorrow. Thank you.
Thank you, Dr. Sam Mills, for highlighting such important gains registered by the MOH during this period under the leadership of Honorable Ahmed Lamin Samate. I now move on to the next item on the agenda, which is going to be a statement by the WHO country representative, herein represented by Dr. Makawa, to come and give a statement on behalf of the WR.
Honorable Minister of Health, Dr. Ahmed Lamine Samate, Permanent Secretary, Office of the Vice President, Permanent Secretary, Ministry of Health, Mr. Mohamed Lamine Diaté, Representative of ODA Ministry, Director of Planning and ODA Director present here, Chief Executive Officers of the different health institutions, World Bank Advisor Dr. Sam Mills, colleagues from the United Nations systems and the entire diplomatic communities, partner in development, representative of civil society organizations and community, representative of media, distinguished ladies and gentlemen, all other particularly duly observed. Good morning. Apologize from the W2 representative, Dr. Desta, who wanted strongly to participate to this important ceremony. Unfortunately, he is currently abroad and cannot join us here. I'm therefore going to deliver this short speech on his behalf. Chairperson, please let me start by thanking your Honorable Minister of gracing these occasions, and thank you for all coming to this important workshop. Honorable Minister of Health, your presence is a clear demonstration of the high-level commitment you attach to uplifting the health status of the people of the Gambia. I would like to thank and congratulate the Ministry of Health and its partner on achieving this important milestone and also organizing this important workshop. I would also like to thank the Director of Planning and Informations, his team, and the permanent secretaries for their persistent leadership. We would like to appreciate the engagement of different partners, including the World Bank, for the technical and financial support. Honorable Minister, ladies and gentlemen, today marks a special day in the calendar of the health sector. It is a day when all stakeholders, walks of life came together to evaluate what has been proposed as the health sector visions for the next 10 years. We are pleased that the country has been able to work throughout these difficult times and develop a robust draft national health policies. This process has taken over a year throughout numerous consultations, as mentions the Director of Planning. While currently many countries struggle to focus beyond fighting against COVID-19, the Gambia has managed to devote time and resources to developing national strategic plans and new policies. One of the excellent examples, along with this policy development, is the establishment of the new insurance scheme, as already highlighted Dr. Sams. This is a product of hard work and strong leadership within the Ministry of Health with the support of its technical partners. Honorable Minister, distinguished ladies and gentlemen, I would like to reiterate that W is very proud to be among the partners that took part in the different processes of developing this policy. W has made available the service of local and international experts to support the Ministry of Health and partner in this very important exercise. We do appreciate the effort of the Director of Planning and Information in coordinating this activity. As you may all agree, a clean final policy document is not the end of the job. This job has to continue until such a time this policy is translated into concrete results that could change the lives and the well-being of the people of the Gambia for the better. We are happy to note that this draft policy aspires to take the country toward the universal health coverage by 2030. It proposed, as already highlighted, previous intervener, it proposed new reforms and flagship initiatives like the health insurance, decentralizations, quality of care, and a strong focus on currently priority public health challenges, including health emergency and non-communicable disease. Dear Honorable Minister, distinguished ladies and gentlemen, I would like to reconfirm that WHO will continue to support the Gambians' ambitions and progress throughout the universal health coverage. Universal coverage is a critical component of sustainable development and poverty reductions, and a key element to reducing social inequity. WHO will continue to assist the Gambia in translating this policy into results that can change and save life. Glad to say it is our conviction to support the Ministry of Health throughout our new program budget to move the Gambia towards universal health coverage. I'm sure that most of the participants have taken part in one of the consultations during the development of this policy. Today is another opportunity to evaluate the draft policy throughout the different lenses at our disposal. I wish you all a productive and successful workshop, and I encourage all of us to participate actively to improve the quality of this draft National Health Policy document. Honorable Minister, ladies and gentlemen, thank you very much for your kind attention.
Thank you, Doctor. We understand that you are from the French-speaking country, but you've done a great job in speaking an excellent language. Thank you and merci. Okay, thank you. I want now coming to the final part of the opening ceremony on the last item on the agenda. But before I call that particular person who is supposed to lead us into the final statement, this is the person who always say, I want to transform the health sector. This person also continued to say, I want to make the health sector a model in the African continent. The same individual always speak and always say, I want to ensure that there is equitable distribution of health services in this country. And in the development of the policy, the information I got from colleagues is that he always asks, where are we with regards to the policy development process? DPI and team, can you come and kindly brief me as to where we are? And the message is always on the DPI, come and provide me updates on the policy as to where we are. And remember, DPI team, I have a vision for the health sector, and I want the new vision to be included in the policy. This has been this person's words to DPI team, and even as the information I also got was in Monday, he was with the team to have an update as to where we are so that he'll be able to know what to say when he meet with the partners that are here. This individual also provided the enabling environment and support. In an instance where he cannot be able to attend the development of the policy phases, he assigned the permanent secretary, who also assigned his 2IC, in the military language, 2IC, his assistant, to represent him and the entire ministry and the Honorable Minister. Because of the support and then the guidance and as well as the enabling environment, we are able to come this far. And thanks to this individual. And this person is no other person other than someone who is from an area which is an annex to Badibu. It's an annex to Badibu anyway, because we just annexed, it's an annex. If I say annex, I think all of you understand. So he's no other person other than Honorable Ahmed Lamin Samate, who is the Minister of Health. He's now coming to give us his opening remarks. Honorable, you are most welcome.
Thank you very much, Mr. Njai. What I didn't know was that you discuss me sometimes, isn't it, Jibril? So I'm surprised that you got to know the details of what has been transpiring. But I thank you very much for steering the affairs of this validation workshop. Thank you, Mr. Chair. The Permanent Secretary, Minister of Health, the Permanent Secretary, Office of the Vice President, the Deputy Permanent Secretary, Minister of Health, and other Permanent Secretaries and Deputy Permanent Secretaries here present. Our able consultant, who is a veteran of the health sector in this country, representative of the WHO representatives to the Gambia, the World Bank Task Team leader, who is on Skype, representatives of UNICEF, UNFPA, WFPA, UNDP, and all other UN agencies here present. The directors and deputy directors all present here. Representatives of all other stakeholders. Senior members of the medical fraternity here present. Community leaders here present. We realize that the head of Munazamat is also here, who is also quite an experienced person in policy formulation in various countries. We're opportunity to have her here. All staff of the Ministry of Health and all other partners here present. We are delighted to stand in front of you here, and we are very pleased to know the seriousness that has been put in the development of new health policy. That can be gauged by the level of attendance in this meeting. It shows that the Ministry of Health and all its partners are taking this process very seriously. Today marks a very significant day in the history of our healthcare dispensation, as we are gathered to validate one of the most important policy documents of this country. This will serve as a guide for the delivery of healthcare services in our beloved country. It is therefore my singular honor to preside over this important occasion, as it is a great moment for all of us to be here to validate this new draft health policy 2021 to 2030. The policy will serve as a guide for healthcare delivery in the Gambia by providing an impetus and a new direction for the health sector development. It will also serve as a basis for driving our health sector priorities and planning as a good resource allocation process, and it is envisaged that going forward, all other health-related policies shall be anchored on this. The theme, Building Partnership for Quality Healthcare for All, is the current philosophy on which our national health policy is hinged. It is an indisputable fact that partnership is central to our day-to-day operations, as the mission of the ministry clearly states that the sector must forge partnerships for the provision of quality and affordable healthcare for the population through equitable provision of quality health services within the context of primary healthcare. It is aimed at reducing out-of-pocket expenditure and ensuring that no one suffers financial hardship because of ill health. Distinguished participants, ladies and gentlemen, this policy is expected to reform the health system by addressing the major traditional problems of health, the new and emerging health challenges, and putting in place measures to respond to emergencies. It is expected to reduce the burden of communicable and non-communicable diseases by addressing major risk factors, including tobacco use, unhealthy diet, physical inactivity, and the harmful use of alcohol. This policy will also foster effective partnerships, networks, and alliances among health and non-health professionals, government, private sector, civil society, multiple development sectors, and communities in order to harness new technical and financial resources for the health sector. It will facilitate multi-sectoral actions such as community participation, social dialogue, other partnerships, and innovative financial cooperation, and innovative healthcare financing such as the National Health Insurance Scheme, aiming at protecting the health of the people across the length and breadth of this country. Ladies and gentlemen, I have the strong conviction that the implementation of these policy measures will certainly impact on reducing morbidity and mortality from major diseases, promote a healthy lifestyle, and reduce health risks and exposures associated with negative environmental consequences such as climate change. It will further provide the basis for an institutional and legal framework for mobilizing sector-wide resources and health service provision for the entire country. Distinguished guests, ladies and gentlemen, the formulation of the new national health policy is coming at a very good time in the history of this country. It's coming at a time when there is very strong political will to strengthen the health sector, to develop the health sector. It is coming at a time when the government is focusing on expanding and strengthening the healthcare infrastructure, when the government is thinking of building capacity to get a skilled workforce, a very highly skilled workforce in the country. It is coming at a time when the government is making the provision of life-saving equipment to the health facilities a priority, and also endeavoring to ensure the constant availability and sustainability of the medical supplies in our healthcare system. Ladies and gentlemen, it's also a fact that is also coming at a time when the world is experiencing a pandemic that we've never seen before. So it gives us the unique opportunity to incorporate pandemic-related policy statements, pandemic-related visions, because without this pandemic, probably this health sector would have been developed without paying attention to any such. And midway between, if there were any pandemic, we wouldn't have had it in our policy documents. But now we have the opportunity to ensure that we strengthen the public health sector. This should all come out in the policy document very strongly to ensure that the people of the country and the world are protected. So I think no country has been stretched with regards to healthcare service delivery the way we all have been recently. and we happened to be developing this policy at that time. So there should be no gaps. The previous policy document was very useful, and it has increased, it has supported, it had been the foundation for healthcare development in this country. Nonetheless, going through it, we all realize that there have been a number of gaps, and this is an opportunity to ensure that those gaps are filled in and the new challenges are also addressed in the policy development. We know you are going to do a very diligent job at this, but this is a national issue. Yes, certain policy modifications may affect the status quo, but in national development, we look at the national interest and what is sustainable, not tailoring policy to the status quo that is favorable to us as individuals. So we should be very mindful of that. So let us look at the broader picture, that the policy is for national good. Yes, certain policy inclinations in the new policy may not favor our current situations in our various units, but that notwithstanding, if it is good for this country, we should take the bold step to put it in, because as I keep on saying, these positions are not our birthrights. People were there before, we are here today, and we will move on, others will occupy them. But a strong policy document is available for the country, and anyone who comes should meet these good policy documents. So that is very important. So when we look at the policy issues, we look at them with an open mind and look at what is best for this country. Once again, I'm very happy to be with all of you here today. And at this juncture, Mr. Chair, allow me to acknowledge the participation of all the directors, program managers, unit heads, and all the members of staff of the Ministry of Health, whose expertise and brilliant input made this draft policy document available for us to look at today. Special appreciation go to the staff of the Directorate of Planning and Information for leading the development of this policy under the leadership of Mr. Jibril Jaju. And I must say, we've been pushing them very hard. 2 days ago, we were in the office till close to 10 p.m. because we needed to look at the document. As Moru said, we cannot ask you to look at a document that we have not scrutinized ourselves. To me, it doesn't make sense, because at the end of the day, we are going to be the ones who are going to put forward the policy document leading the health sector. So we spent quite some time looking at it. We thank the consultant, Dr. Melville George, for supporting and participating in the development of this draft process. You all know by his resume that was just announced here that he's probably one of the most competent people in this country to help in such an endeavor. And that is a very important thing that we want to put forward to our fraternity. We have very experienced people at our disposal, available. So let's make good use of them. All they need is for us to tell them, we need your help. And they are always ready to help, because these are people who have sacrificed for this country. When the salaries were so little, they went to all parts of this country, sleepless nights, to make sure the health sector, the system worked. They've gathered all this experience, and they are right here around us. So I keep on telling them, some of us are very fortunate to have such experienced people in our midst, whilst we are being given these responsibilities. So let's make very good use of them, and we are happy that he accepted to support this process. And for me, he has been very supportive. Thank you. Our appreciation also goes to the other ministries, departments and agencies, academia and other partners for their active collaboration and the provision of vital information for the enrichment of this document. Our sincere gratitude goes to the city and municipal councils, regional governors, chiefs, Kalolu, and all community members visited during the policy consultation for their valuable contributions. Finally, we are most grateful to all our development partners, especially the World Bank, UNICEF, the WHO, the UNFPA, for their technical and financial support rendered during the development of this policy. And we also sincerely thank Dr. Sam Mills, who is the World Bank Health Task Team Leader, for his encouragement and for his support and perseverance, and for pushing through. Yes, you have partners, they have their responsibilities, but they can deliver their responsibilities just the way they want to. But they can equally also deliver it with passion, enthusiasm, and interest. And fortunately, Dr. Mills, that's how he has been performing his duties, and we thank him very much. Ladies and gentlemen, certainly for very successful endeavors, certainly there would have been a lot of good work, a lot of hard work that would have gone into it, and no effort is unappreciated. We appreciate all the effort, whether big or little, towards the successful putting together of this draft document, whether we mention the person's name or the group's name or not. We sincerely appreciate all your input, and we wish to thank you very much. Ladies and gentlemen, with these remarks, I now have the singular honor to declare this two-day validation meeting on the draft National Health Policy 2021 to 2030 officially opened. Thank you very much.
A round of applause for spearheading this process. And now I don't want to say any other word after he has officially opened this session. I now advise that we move out and then have the group photo. From there, then we can have coffee. And the media is here. You may have some interviews with the Honorable Minister, the PS, the Director of Planning, the consultant, they're all here. If you want to get them, kindly come forward and we'll do the arrangements for you. Thank you. Now we can move out and to the hall. Outside the hall, we have the group photo.
Love like fire. Wow. Love like fire. Xam ngeen rek affaire bi xam ngeen fan la? Skincare la. 2020 lañ wax de. Waaw. Fii nag mooy Kerr fan, Kerr zero tache. Perfect skin. Skincare saa su ne rek niñ ko dee defee rek. Loo lañ soxlaati rek. Maanaam bu ngeen am problème ci seen skin yéen xam ngeen fan la fii ngeen di ñëw suma xarit yeeg am di jàmm yi nga xam ne taas daf lañ sonaloon xam nga doon xeesal ba laka xum éneew ma lañ ko nag waaye just in case comme ni ko gars yi defee rek en cas just in case loolu xew xam ngeen fi ngeen di ñëw fii ngeen di ñëw Skincare Plus si yu baax rek la ñoo dox nag ay baax rek fu ne la ñoo dem ci réew mi di lañ indi rek nag products yu baax du Paris du Italie du USA du fi mu nekk nii sax boole nañ ci nag Sweden fu nekk lañ leen a indilee products bu dee tamit nag da nga ñuul rek ñu lay jamaa natural beauty that melanin dripping we do have stuff for you as well emuñ si skincare products rek ñu ngi ci cuub yi tamit fu ne la ñoo jaar in fact sax last commercial bi ñu defoon waxuñ leen woon ne dañoo dox ci ay kawar 9A grade rek nag waaw we do have bundles as well hair si lu ne la ñoo dox ñun ñu ngi ci rafetal jigéen rek luy taaral jigéen rek waaw boo leen di tukki tamit bëggoon rek classic suitcase ñu dañoo dox ci ay Samsonite duñ dee indi any brand of suitcases though other than Samsonite comme li ma dee wax rek boo eggee airport dëri Samsonite dafa am nuñ laa xoolee waaw ngeen ne lan nag waaw skin ci moom la ñu gën a xamee nag skin care products ci moom la ñu gën a xamee ñu ngi dox tamit bentey tamit si ay dàlla man waaye man nag skin care mooy suma specialty xam nga rek jigéen bu sa xar kanam réglé loo def mu jag am nañ Patricia Reiner Kiwi Eye the whole range Lighten Up Gold Tomatine I mean the list can just go on and on and on and on lépp loo xam ne rek luy taaral jigéen la ci yooyu rek la ñoo dox skin care plus nag emuñ si Gambia rek ñu nga United States ñu ngi Gambia fii ba pare bu dee yaa ngi anywhere in Europe mun nañ la ko mail within 3 days rek ñetti fan rek nga jot say diw emuñ si loolu rek dañ laa consult tamit balaa ñu laa jaay diw dinañ def a free consultation pour wax la rek exactly li nga xam ne moo méngoo ak sa kanam dinañ leen wax tamit ne rek am nañ perfumes you know fragrances men's shirts accessories we do dresses as well we do blouses I mean we do shoes name it we do them Skincare Plus 2020 is our year of perfection zero task fi mu nekk nii réew mi fii kenn waratu fi taas kenn waratu fi am problème kanam kenn waratu fi am problème yu picca boo ko amee dafa fekk ne rek ñëwuloo ci place bi fii
love like fire bring my love like fire
Agada
ke mbijan ro aga nyaade
albaka
mbaka important
yo nga transfer la sto
ya transfer la
ha code nyinji
okay important nsila id soto
ha sa soto sorry agada
mbijan ro
albaka
mbaka
bara alla service o tariaka
mbare
mo ki janna nun kunu bara tariaka
jannom yona forest de bureau Gambia tonkon na no mbari ya bere birin koyna fo katon
bari si kodo kino katon nim fo bolong blabe
56 branches mola soto Gambia ja
ha
Gambia kono ani Gambia e bantala bankol nko kodo kiya bere kodo sifa fo falindiro fo nyaadi lafta memmen na kodi to poto nin kodi maraw jannam number 1 di nyonta andum fana nata anoda enterprise sotale wolam nyindi ko domorol fana kol fana be firale le dadi mani domorol dil fana beteat Gambia dawda yalo ngam fa kendol sotale je
wo moy wadiat
apelenta
barka ni ma lafta nyelen kendol e binaji
yalo bu kanyi la ko la barka ba
yalo ndel ciosano lo
barka
We live in a day and age where technology is creating a world without borders, filled with unlimited potential to improve the lives of the people around us. Innovarex Global Health ushers in a new way of leveling the playing field with increased access to quality healthcare services delivered at your doorstep. Our qualified professionals are equipped with state-of-the-art point-of-care testing technology to conduct tests such as kidney function, liver function, electrolyte tests, body composition, hemoglobin, A1C, and many more services with the highest efficiency in delivering results. The addition to our flagship Wellness on Wheels, more fondly known as WOW Delivery Service, brings the entire clinical experience full circle. IGH has remained committed to creating the future of healthcare delivery. Gone are the days of sending loved ones outside the country for basic medical services. Innovarex Global Health offers a new peace of mind and takes pride in delivering the quality of care we all deserve.